Hi, how are you? Nice to meet you. So, you guys are coming from Lakeland? Okay. So, I saw the record. When did you have your biopsy for the prostate?
Oh.
Do you remember the exact date?
Like it should be on the...
I didn't see when they did this.
Is that the biopsy results there?
Yeah, so this is the prolapse. So was this in November?
Yes.
November of 2019?
Yeah.
Okay.
Yeah.
And then I saw you had a CAT scan. So what has been happening since all of this?
Well, the CAT scan is because I've been having stomach pains a lot. I mean, I've been diagnosed with gastritis, but I've been having like severe pains and stuff. So they sent me to go get a colonoscopy.
Okay.
That doctor recommended all that blood work and the scan before that, and then that's when I found out I had a gallstone and then a cyst on my kidney.
Yeah.
There.
Okay.
But that was through that.
That was through that.
Right. That was from that doctor there and stuff.
So obviously, I saw they did the biopsy. They found 3 spots where there was cancer. Okay. In the prostate, and the type of cancer that you have is in the middle. Okay. So it's not the most aggressive, but it's not the most benign. It's in the middle. But you're a young guy. Okay. This cancer over time will grow. It's not going to happen tomorrow, but it's, by the time you're 60, this can do something bad. So what did they tell you about the prostate cancer?
Not much, just like, you got cancer, and then all of a sudden let's send it out and then come back, and then he was just giving me 2 choices, but not really what you just said. I didn't even know I had 3 spots. I didn't know that. How bad it was.
Yeah. So I mean, basically, look, your options on the table right now are either to consider surgery to remove the prostate or to do radiation. Okay. Now, both of them work. Okay. Both can cure you of your cancer. Okay. But the side effects are different. Okay. With surgery, okay, once you lose your prostate, okay, surgery takes about 2-3 hours. Okay. You're in the hospital one night, and you have to have a catheter, okay, for about 1 week. Okay. When that catheter comes out, okay, you're gonna leak urine. You have to wear pads in the underwear. Not forever, okay, but for at least, for a few weeks to a few months. As you get farther away from the surgery, within 1 year, 90% of guys stop leaking. Okay. Erections. After the surgery, your erections are going to be weaker. You're going to need to take medications like Cialis and Viagra and things like that to help the erections. But it's going to take time, and they're going to come back slower than the leakage. But so with surgery, your side effects happen right away. With radiation, it's different. In the beginning, the side effect, you may have, some guys have a little diarrhea. But as you get older, so 2, 3, 4 years from now, is when you can have difficulty with urination. You can have difficulty with, getting up at night, can't control it, pain with urination, blood with urination. Erections, over time, the erections will go down. Okay, so 2, 3 years from now, things will get worse. So that's the difference. The cure is the same, but the side effects for surgery happen right away, and then they get better. Radiation, the side effects are okay right now, but over time they'll get better. So for you are how old now?
I'll be 54.
54. You're a relatively young guy. You potentially can live another 25, 30 years, right? In you, it may be better to consider surgery.
That's what I've been considering.
Because then you don't have to worry about the side effects when you're 60.
Yeah, that's what I want. I mean, that's what I've been thinking about. Yeah. I mean, I'm solid on the surgery.
Yeah.
Erections, I'm not trying to say life erections.
Yeah, sure.
Guess what? The leakage is I have to do that, but it's just the catheter.
Yeah. But it goes in while you're asleep,
okay.
And then so you're not going to notice it, okay?
Okay.
And then it comes out. It doesn't hurt when it comes out.
Okay.
You do robotic?
Yeah. So I do the most on the west coast of Florida. I do about 200 guys a year. Okay. So have you had any other surgeries before?
I just back surgery and the ACDF. I got a little titanium plate in my neck, but
okay. All right. And you're not on blood thinners or anything like that?
No.
Okay. Do you have any specific questions about the surgery?
Other than work time, how long would I be out?
So look, you're in the hospital one night. You have to have the catheter for a week. And then the first week without the catheter, most patients are kind of just getting, they lay low. And then the third week is when they can start going back to work life. So
Even.
you may, probably for you, 3 weeks.
Okay.
Or 2.5. For sure.
That's good.
Yeah.
Yeah, I mean, like, I'm not worried about the weeks. It can be 4 weeks. It can be 5. That's just my main thing. It's like, just calculating.
Yeah, so it's going to be about, I would say, realistically 2.5, 3 weeks.
Right.
Especially because you got to lift heavy things.
Right.
Okay, because if you didn't have to lift heavy things, then but I'd say if you're going to lift heavy things, 3 weeks, 4 weeks is probably better because you don't want to get a hernia.
But my whole thing is like I just want to know when I can lift things up personally.
I mean, the lifting part is going to be the hardest part, and so that's going to probably take you maybe 3-4 weeks. Okay. Any other questions?
We removed the cancer and all that.
Yeah.
Okay. And then I have to get checked every year to make sure.
Yeah, every 4 to 6 months you'll get a blood test, and then we check that to make sure that the PSA stays 0.
Okay. Did you have any questions? Or?
The thing with the kidneys, you do too. The thing with the kidneys.
It's just a cyst. You don't need to do anything for the kidneys for this.
Okay.
Yeah, it's not anything.
That's what we want.
Yeah, there's nothing dangerous or anything like that.
Okay, just a cyst.
Yeah.
Okay.
Okay. Oh, with me possibly, like I have to go for a lupus test.
Mm-hmm.
That wouldn't interfere with anything there.
Not necessarily. No.
Okay.
Are you on any blood thinners?
No. I'm not on no blood thinners.
Okay.
They're just trying to figure out because possibly there might have been a little marker showing I might just have to just be a carrier, but not. But like my whole body just has been in pain. I have neuropathy.
Yeah. No, it won't change
that other
anything.
good stuff there.
Yeah.
But that's good because it gives me time.
Yeah, it gives you time and stuff like that. Plus you get the colonoscopy and stuff. So we'll get it all scheduled and we'll go from there. Okay.
Yeah. It's like I said. It's just like. I'm scared of needles, number one.
No.
But number two, it's just a catheter.
It's okay. You're not gonna know. It's gonna go. You're gonna be asleep when we put it in. So you're not gonna
I know.
Okay?
I'm just saying, like that's. It was really like the biggest thing on my mind was just like I'm not worried about the surgery. It's just the freaking catheter.
Yeah.
Like, oh my gosh, like.
Yeah.
Okay.
All right. So I'm gonna start the paperwork.
Yes.
And then Lauren will be here to go over the scheduling for you. Okay.
Okay.
All right, guys. Nice to meet you.
I appreciate all that information.
Okay. No, I'm happy to help.
You helped me out there.
Okay. So just hang out here. They'll get everything set up for you. Okay.
Hey everybody, it's BB. Well, you just heard the second opinion. He went to USF Morsani Center on the campus at USF. He did have 3 spots of cancer, and good thing we did the Polaris test because that determines how aggressive or non-aggressive your cancer is and your treatment. His is a middle cancer. So it's moderately aggressive. The surgery could take 2 to 3 hours. And of course, definitely with what he does with lifting and everything, out of work for up to 3 weeks. Then, my guy who does not like blood work is now going to have to get it every 4 to 6 months. So that'll be checking his ANA numbers, his white blood cell count, everything, to make sure that after the surgery everything is going good, cancer's not coming back, or infections, all the above. And he will not be considered cancer-free until he is cancer-free for 20 years. Like with any cancer, and with his being a moderate cancer, at any God-given time, it can rear its ugly head and decide to come back. Maybe not in that particular area, but somewhere else. So, with that, let me just stress, it is always good to get a second opinion. It is always good, if you are diagnosed with prostate cancer, to get the Polaris test. Have it sent to Utah, find out what kind of cancer it is, how aggressive it is, and know your treatments, your treatment options. Because other than that, you're getting treatments out of the blue. You don't know for sure if it's going to work. We all know when it comes to cancer, it's always a shot in the dark. But with today's technology, modern medicine, you have a better chance of fighting it, killing it, and keeping it out of your body. So with that being said, I hope this information that we're putting out is helping people, giving you ideas, and taking some of the fear out of it. We're hoping that it gives people more knowledge, more understanding of what's going on with this particular type of cancer. Now, everybody is different. Everybody's going to have a different type of cancer. But always research it. Do your homework. Knowledge is power when you are talking about cancer of any kind. Whether it's for prostate cancer, breast cancer, uterine cancer, any kind of cancer. Knowledge is power. Do your homework. Try to find out as much as you possibly can. Always get a second opinion. It doesn't matter what you may have going on. It doesn't hurt to get a second opinion. Anytime you have an illness, it's always good. A major one like this. Always get a second opinion. So with that being said, again, I hope this has maybe helped people out there that may be going through the same thing we are. And if it has, good. If you have any questions that we may be able to answer, please leave a comment in the comment box and we will get back with you as soon as we possibly can. So until our next video, guys, see ya.